Welcome to today's deep dive. I'll be your host as we unpack some pretty staggering global data.
And I'm your resident policy expert, ready to get into the weeds of how things actually work behind the scenes.
So, to kick things off, I want you to just visualize standing in the beverage aisle of a typical massive grocery store.
We've all been there. Right?
Right. You're scanning the shelves, looking at the price tags, and you start to notice this persistent structural disconnect.
Oh, absolutely. The pricing is wild if you actually pay attention.
It really is. You've got a heavily processed, artificially sweetened soda or maybe a huge multi-pack of mass-market beer.
Yeah.
And right next to them, you have plain bottled water. Or maybe a locally sourced, unsweetened alternative.
And the water is somehow more expensive.
Exactly. More often than not, that highly processed sugary soda or cheap beer costs less per ounce, sometimes significantly less.
It's completely counterintuitive.
It is, but we see this pricing disparity so frequently that we kind of just treat it as a natural law of retail. Like, oh, it's just how supply and demand works.
Right. But the reality is far more intentional. That price tag is not a coincidence.
No, it's the result of a highly engineered, systemic pricing dynamic.
It's a dynamic we rarely question, honestly. Because, we're conditioned to accept shelf prices as just the sheer outcome of manufacturing efficiency.
Yeah, mass production equals cheaper goods.
Exactly. But those prices are actually heavily dictated by macro-level fiscal policies, specifically by what governments choose to tax, and maybe more importantly, what they deliberately choose not to tax.
Which is fascinating.
Because when you have a product that requires massive global supply chains, intense processing, huge marketing budgets, yet it still sells for pennies.
You have to look for the invisible mechanisms keeping that price artificially suppressed.
Exactly. In economic terms, when a government fails to tax a product that causes long-term societal harm, that inaction essentially functions as an active, ongoing subsidy for the manufacturer.
That concept in action as a subsidy is kind of the perfect lens for our mission today.
It really frames the whole issue.
Today we are diving into a very revealing news release published in January of 2026 by the World Health Organization.
A really crucial piece of data.
Yeah, the release is titled, "Cheaper Drinks Will See a Rise in Non-Communicable Diseases and Injuries."
Which is a heavy title, but incredibly accurate.
It really gets straight to the point. It serves as a high-level summary of two new global reports from 2025. And these reports analyze how countries around the world are utilizing, or frankly, failing to utilize health taxes on alcohol and sugar-sweetened beverages.
And just to clarify, these reports are far from your standard dry fiscal audits.
No, not at all.
They highlight a global health crisis that's basically operating right out in the open.
Yeah.
And it's heavily facilitated by outdated tax codes.
Right. The data they present fundamentally challenges our perception of what affordable actually means.
Yeah, affordable for who?
Exactly. So our goal for this deep dive is to unpack exactly why these harmful drinks are remaining artificially cheap.
We're going to look at how global tax systems are currently dropping the ball.
And the specific structural loopholes that allow major beverage categories to just escape taxation entirely.
Plus the WHO's ambitious plan to flip the script by 2035.
Right, the 3x35 initiative. So, if you have ever wondered why it seems financially punitive to make a healthy choice at the checkout line, well, this data provides the blueprint.
So let's start with the big picture. The central thesis of the WHO release is that sugary drinks and alcoholic beverages are actually getting cheaper relative to inflation and income growth.
Which is wild. Everything else is getting more expensive.
I know. But as median wages increase and the general cost of living rises, the cost of these specific products just isn't keeping pace.
So they're taking up a smaller and smaller percentage of a buyer's disposable income over time.
Exactly. And the root cause identified by the WHO is a landscape of consistently low, poorly structured tax rates across most countries.
Let's talk about the fallout of that affordability. Because calling a drink cheap is highly deceptive when you factor in the defayed costs.
The term cheap completely breaks down when you zoom out from the cash register.
Because someone is paying for it, eventually.
Exactly. This systemic affordability is a direct driver of non-communicable diseases on a massive scale.
We're talking obesity, type 2 diabetes, cardiovascular disease, various forms of cancer.
And regarding alcohol, you see a severe escalation in traffic injuries and interpersonal violence.
Right.
What the WHO data really underscores is the generational impact. This burden hits children and young adults the hardest.
Yeah, when an energy drink or a highly sweetened beverage is the most accessible, affordable option for a teenager.
It establishes metabolic baselines and consumption habits that basically guarantee chronic health interventions later in life.
So the price on the shelf is just a fraction of the true cost.
Exactly. The remainder is essentially a debt passed on to the public healthcare system.
Dr. Etienne Krug, a director at the WHO, frames this economic imbalance so starkly. He points out that the global market for these beverages generates immense corporate wealth.
Billions.
Billions in sustained profit. Yet, governments capture only a tiny, minuscule fraction of that wealth through health-motivated taxes.
It is the textbook definition of privatized profits and socialized costs.
Yeah.
The beverage industry captures the immediate financial upside of high-volume sales, which are driven by that artificial affordability.
But when that prolonged consumption results in millions of diabetes diagnoses or alcohol-related hospital admissions,
The industry is not covering those medical expenses.
the taxpayers are.
Exactly. Taxpayers and public health systems are left holding the bag. The current tax paradigm allows the negative externalities of these products to be entirely offloaded onto the public sector.
I think that's worth keeping in mind the next time you are standing in that grocery aisle.
Yeah.
The deal we think we're getting on a 2-liter soda is just an illusion.
We are collectively paying the balance of that transaction through higher insurance premiums, strained medical resources, and lost workplace productivity.
Which naturally leads us to look at how governments are currently attempting to manage this.
And exactly why those attempts are falling so short.
So let's look at the first major report finding, which focuses on sugar-sweetened beverages. The WHO notes that at least 116 countries currently have some form of tax on sugary drinks.
Which, on paper, sounds great. It sounds like a massive global consensus.
Right, it sounds like a win.
But this is where the policy mechanics become critical. When you actually look at the structure of those taxes in those 116 countries, you uncover massive regulatory loopholes.
Loopholes that completely compromise the policy.
Absolutely. The majority of these existing taxes are super narrowly written. They target traditional carbonated sodas.
So miss everything else.
They completely bypass a massive, rapidly expanding chunk of the market. Products like 100% fruit juices, heavily sweetened milk drinks, and ready-to-drink teas and coffees, they frequently escape taxation entirely.
It's a fascinating double standard. Let's use a real-world example.
Yeah, go for it.
You can walk into a premium grocery store and buy a cold-pressed green juice or a bottled vanilla latte.
Right.
And because those products carry a strong health halo, they're marketed as natural fruit or dairy or artisanal coffee. They slip right through the tax notes.
Unscathed.
But if you actually look at the nutritional label, that green juice or that latte often contains an identical, or sometimes even higher, concentration of liquid sugar than a standard can of cola.
Exactly. The health halo is a incredibly powerful psychological and regulatory shield.
It really is.
The policy design is just fundamentally flawed. It treats the carbonation or the arbitrary classification of soda as the target.
Instead of the actual problem.
Right, instead of the physiological mechanism of harm, which is the high concentration of rapidly absorbed liquid sugar.
So if a tax code leaves half of the sugary beverage market exempt, it doesn't reduce overall sugar consumption at all.
No, it merely shifts consumer behavior. A buyer might put down the tax cola and pick up an untaxed, heavily sweetened iced tea.
The market share moves, but the negative health outcome remains exactly the same.
Exactly. And even in the instances where the tax does apply to a product, the numbers are just surprisingly weak.
Yeah, the report states that the median tax globally accounts for only about 2% of the price of a common sugary soda.
2%.
Let's push back on that for a second. Does a 2% tax even function as a market signal to the consumer? Or is it purely a revenue-generating facade for the government at that point?
It's almost entirely the latter. A 2% tax is functionally invisible at the point of purchase.
Yeah.
If a beverage costs $2, a 2% tax adds 4 cents.
4 cents isn't stopping anyone.
Exactly. That increment is not going to interrupt a consumer's purchasing habit. It doesn't make a healthier, untaxed alternative look financially competitive.
Right.
For a health tax to act as a genuine deterrent, what economists call causing sticker shock, It needs to be substantial enough to actually alter the consumer's cost-benefit calculus.
So a 2% levy acts more like a minor administrative toll on the manufacturer than a serious public health intervention.
Window. And the momentum for reforming these sugar taxes seems to have completely stalled out.
Yeah, the WHO release points out that while 97% of countries tax energy drinks, that specific figure hasn't moved a single percentage point since the last global report in 2023.
It's totally stagnant. Governments implemented these minimal, poorly targeted taxes and then just walked away.
Leaving massive volumes of sugar to be sold without actually mitigating the downstream health crisis.
Which is a perfect segue into the second global report discussed in the release, dealing with alcohol taxation.
Right, because if the sugar tax framework is riddled with these health halo loopholes, you'd probably expect alcohol, which governments have regulated for centuries, to have a much tighter framework.
You would think so. But the data reveals a very different reality. And the stakes regarding immediate physical harm and long-term disease with alcohol are incredibly high.
So looking at the baseline, the report confirms that at least 167 countries levy taxes on alcoholic beverages, and 12 countries ban it entirely.
So the mechanism of taxation is nearly universal.
But the implementation is where it all falls apart, because these taxes are predominantly fixed nominal amounts rather than percentages tied to inflation.
Yes. This is a crucial distinction in tax policy mechanics.
Explain that difference for us.
Sure. There are generally two ways to levy an excise tax. You have ad valorem, which is a percentage of the product's value, and you have specific or nominal, which is a flat monetary amount per volume.
Okay.
Many alcohol taxes globally are set as specific nominal amounts. So if a government sets a $2 tax on a bottle of spirits and leaves that law untouched for a decade, the tax remains exactly $2.
Ah. Meanwhile, general inflation drives up the cost of goods, rent, wages, everything else.
Exactly. That flat $2 tax gradually represents a much smaller fraction of a consumer's purchasing power.
It effectively shrinks.
It does. By relying on nominal taxes and failing to index them to inflation, governments are passively allowing alcohol to become more affordable over time.
Since 2022, alcohol has either become more affordable or stayed exactly the same price in most countries. It's a massive structural blind spot.
It really is.
And it makes you wonder why legislation is written this way in the first place. Surely policymakers understand basic inflation.
Oh, they absolutely do. And this is where industry influence heavily shapes policy.
Tell me more about that.
Well, beverage lobbies strongly prefer and advocate for specific nominal taxes over ad valorem taxes.
Because they know it'll lose value.
Precisely. They know legislative bodies are slow to act, and passing a new tax increase is always politically difficult.
So by locking in a flat monetary tax, the industry gets a guarantee that inflation will slowly dismantle the tax's impact over time.
Without them having to lobby against new bills every single year.
Wow. That is a brilliant, albeit deeply cynical, long-term strategy.
Very effective.
And speaking of industry influence, there's a statistic in this report that genuinely surprised me. Wine remains completely untaxed in at least 25 countries.
It's staggering.
Zero health tax.
Yeah.
And the vast majority of these exemptions are concentrated in Europe. We tax the sugary soda, but we let the Cabernet slide entirely.
The European wine exemption is the premier example of how historical agricultural policy and cultural lobbying can just entirely override modern public health data.
Because wine is seen differently there.
Yes, exactly. Within Europe, particularly under frameworks like the Common Agricultural Policy, wine has long been treated less as an intoxicant and more as a foundational agricultural staple.
It's deeply tied to national identity and rural economies.
Right. There is a deeply entrenched, romanticized health halo surrounding wine consumption.
But the science doesn't support that halo.
Not at all. The scientific and medical consensus is unequivocal. Alcohol, regardless of whether it's fermented in a prestigious vineyard or distilled in a factory, is a known carcinogen and a primary driver of numerous non-communicable diseases.
So to have 25 nations declining to levy any health tax on it whatsoever,
It just demonstrates the sheer power of agricultural lobbying over objective health policy.
it highlights a massive inconsistency in how we regulate harm. And even in the countries where alcohol is taxed, the baseline rates are remarkably low.
Very low.
The report provides the global excise share medians, which is the percentage of the final retail price made up by the excise tax.
Right.
Globally, the median is just 14% for beer and 22.5% for spirits.
To contextualize those figures, public health economists generally advocate for the excise share to be substantially higher, to even begin offsetting the societal damage.
So 14% isn't cutting it.
A 14% tax share on beer is mathematically insufficient to fund the emergency response for traffic accidents, the treatments for liver disease, the broader addiction recovery services.
All the things required by a population with access to highly affordable alcohol.
Exactly. Dr. Kruv's statement in the release is unequivocal. Affordable alcohol directly drives violence, injuries, and disease. The current tax medians are simply not scaled to the reality of the damage.
Which inevitably leads to a central question. If the current tax structures are failing, if the loopholes are glaring, and the resulting public health costs are draining national budgets, why aren't we fixing it?
It's the multi-billion-dollar question.
Conventional political wisdom suggests that any new tax is basically political suicide. But looking at the WHO release, is that really the whole story?
The conventional wisdom is actually a major hurdle, but it's increasingly contradicted by the data.
How so?
The WHO release cites a fascinating piece of context regarding public sentiment. A 2022 Gallup poll found that the majority of people surveyed actually support higher taxes on alcohol and sugar-sweetened beverages.
Really? That feels counterintuitive at first glance. We assume the public is universally hostile to tax increases.
It does seem counterintuitive, but it reveals a highly sophisticated public understanding of the issue.
People see what's happening.
They do. They are acutely aware of the health impacts within their own communities. They see the rising rates of early-onset diabetes. They experience the downstream effects of alcohol abuse.
So when a tax is explicitly framed as a public health measure,
Yes, targeting the manufacturers of harmful products rather than just a general income tax, the public is generally supportive.
so the hesitation isn't coming from the voters?
No, it's coming from policymakers. They're either operating on outdated assumptions about voter backlash, or they are highly responsive to industry pressure. The policy is actively lagging behind the public will.
That completely flips the narrative. And the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, frames these health taxes in a way that highlights their unique utility. He describes them as a powerful dual-threat tool.
The dual benefit is what makes health taxes so structurally elegant when they are implemented correctly.
Break that down for us.
First, by implementing a substantial ad valorem tax, you increase the price and actively deter harmful consumption.
Effectively preventing disease before it requires medical intervention.
Exactly. And second, the revenue generated from the remaining avails creates a dedicated, predictable funding stream that can be reinvested directly into the healthcare system.
It's a win-win. You simultaneously reduce the burden on hospitals while increasing their operational funding.
Precise.
To put this into action and break through the current stagnation, the WHO has outlined a highly specific initiative called 3 by 35. And rather than just suggesting countries, do better, they are providing a measurable target. The goal is to actively increase the real prices of 3 specific product categories: tobacco, alcohol, and sugary drinks by the year 2035.
The key word in that initiative is real prices.
Because of inflation.
Exactly. This means moving away from those static nominal taxes we discussed earlier. The 3 by 35 roadmap requires governments to implement dynamic, progressive taxation, likely ad valorem models that automatically adjust for inflation and income growth.
To guarantee that these 3 product categories become steadily and permanently less affordable over time.
To protect human health, yes.
It's a massive structural overhaul. I mean, it means closing the health halo loopholes on fruit juices and lattes. It means ending the agricultural tax exemptions for wine in Europe.
That's a huge lift.
But we have historical precedent to show that this kind of aggressive, dynamic taxation actually works, don't we?
We do, and tobacco is the defining precedent here.
Right.
Over the last few decades, many nations successfully shifted from weak, nominal taxes on cigarettes to aggressive, compounding taxes that dramatically increased the real price of tobacco.
And it worked.
It was one of the most significant public health victories of the modern era. We saw a massive, sustained decline in global smoking rates, particularly among younger demographics who are, most sensitive to price changes.
So the WHO is essentially taking the proven fiscal playbook used against the tobacco industry and applying it to alcohol and sugar.
Exactly. They know the model works.
That precedent proves that the 3 by 35 initiative isn't just some academic exercise. It's a proven mechanism for behavioral change on a population level.
It fundamentally changes how you view the regulatory environment around us.
It really does. Understanding the mechanics of these policies demystifies our daily environment.
It clarifies why our grocery stores are stocked the way they are. and why certain products are priced to encourage mass consumption despite their obvious risks.
Let's briefly recap the ground we've covered on this deep dive.
That's good.
We began by examining the illusion of the cheap beverage, recognizing that inaction on tax policy functions as a massive ongoing subsidy for beverage manufacturers, while the resulting health costs, obesity, diabetes, injuries are all socialized.
We explored the glaring structural flaws in current tax codes. Things like the health halo loopholes that exempt sugary juices and coffees.
And the reliance on specific nominal taxes that allow inflation to quietly erode the cost of alcohol. We highlighted the cultural exemptions, like 25 countries leaving wine entirely untaxed.
And finally, we looked at the disconnect between public support for these taxes and political stagnation.
Plus, how the WHO's 3x35 plan aims to replicate the success of tobacco taxation to permanently increase the real prices of these harmful goods over the next decade.
It is a profound intersection of fiscal policy, industry lobbying, and global public health. The ultimate takeaway is that the affordability of these products is a deliberate choice. It is not an economic inevitability.
That is the exact framing I want you to carry with you this week. The next time you are navigating a store, recognize that the prices you see are not organic. They are the result of macro-level decisions about what we value and what we're willing to subsidize.
And that leads us to a necessary point of reflection regarding our own local and national policies.
Right.
We have the data proving the harm. We have the economic models proving the drain on public resources. We even have the polling data showing that the majority of the public supports closing these loopholes.
So we want to leave you with a final provocative thought to consider.
Yeah.
If the public mandate exists and the fiscal and health benefits have been clearly mapped out by global experts and proven by past successes with tobacco, what invisible dynamics or entrenched pressures are preventing your own local government from acting?
Who is actually benefiting when a highly effective, publicly supported health policy is continually tabled or watered down?
It is a question worth asking the next time you see a massive display of soda priced cheaper than a bottle of water. Thank you for joining us on this deep dive. Keep questioning the structures around you, look closely at the true cost of those price tags, and we will catch you next time.